Hi, I'm Ria. I'm an intercalating dental student, so between years 3 and 4. And I chose this course because it was a really unique course. It combines sort of law and ethics, which not a lot of courses combine. I think it's allowed me to sort of take a step back from clinical practice and understand how change can happen on a larger scale.
Hiya, I'm Maddie Paget and I'm a medical student here at Bristol University. I chose to intercalate in the LLM in Health, Law and Society because I was looking for something that was going to help me really understand how the NHS works and something that might really help me in my future as a medical student and as a doctor one day. When I was looking at lots of different courses around the country, looking at lots of different things, I kind of couldn't settle on one thing that incorporated all the topics that I really liked until I found the Health, Law and Society LLM. You get to look at things like the commercialisation of medicine and the privatisation of the NHS, and even how to practically apply things like mental health law and how that might be changing over the next few years.
And what I've really enjoyed in this course is the mental health unit, so that doesn't get taught as much in dentistry, and so even though dentistry and mental health are so interlinked, it was a great chance to really go into depth about the mental health unit as well.
I'm looking to become a psychiatrist one day, and I think there's this fantastic unit that we have here that teaches us how to change the law, to reform it, and that's something I'm really hoping I can do in the future as a psychiatrist. So it's been great to learn how to practically be able to do that.
I'd recommend this course to any medical, dental, veterinary students because you get to talk and debate with some of the leading academics in the field. They're really helpful, they're really supportive, you get the chance to have an opinion and voice your opinion, which is not so much so in a dental, medical, veterinary field. And it also allows you to be really creative, especially with the law reform project, so explore areas which you probably haven't touched upon before.
I think this course is probably essential for anyone that's looking to go into any kind of leadership position as a doctor in the future. It's helped to no end my understanding of the functioning of the NHS, not just from the doctor's perspectives, but from an admin and an organisational perspective. I think that will be completely invaluable. If you're interested in finding out a bit more about this LLM in Health, Law and Society, check out the video for more about what we go into and the type of students we're looking for.
The LLM in Health, Law and Society is a postgraduate taught qualification in law that examines the relationships between law, governance and health.
Students can expect to cover a diverse range of topics, from the regulation of the human body to social determinant of health and the impact of health inequality.
I am from Western Canada, and growing up my mum was a nurse, and I think that's a reason why I was really interested in being a part of health law. One of the most unique things is the diversity of contact matter and then just the different sort of people that you interact with.
I chose to study on LLM as well as working full-time as a paramedic because the programme allowed me a chance to step back from clinical practice, to reflect on what I do day to day, but also to look at a broader range of issues and how they affect my patients within the community.
The Bristol Health, Law and Society course really appealed to me because you didn't need to have a background in health or law. It was challenging coming from geography to come into law, but actually there was a lot of support from the academics.
Having the contrast of people with professional experience and those who are fresh out of studying is invaluable.
The university has a Centre for Health, Law and Society, which allows academics and students alike to develop research interests and specialist knowledge on topics.
We see both staff and students as equally contributing to debate and discussion of ideas and development of research.
I really enjoy the academics and the staff that we get to work with. They come from really interesting backgrounds as well. We have some people in governance, some people that have been in practice before, and so it's really great to just have those sort of people to not only direct your learning, but also direct your career path as well.
What I find inspiring in the course is the focus on health inequalities, and the Masters is helping me to find out how we can achieve justice and fairness through law.
The Masters is not only helping my professional paramedic practice, but more importantly, will help to provide a better healthcare service within society.